Hello, everybody, and welcome to today's Hamline Leo lecture. Exercise improves immune function, what we've learned so far during the pandemic with Professor Lisa Ferguson Stegall. My name is Molly Glevy. I work in the Alumni Relations Office at Hamline. I'm so pleased to have so many of you join us today. Some of you might know that Professor Stegall spoke in July of 2020 on this topic. And so what a great opportunity to reprise a little of that, bring some new information more than 2 years later into the fold. So thank you again. I'm going to do a few introductory slides here, and then I'm going to hand over the reins. Here we go. I'm guessing you're all very familiar with Zoom lectures and events at this point, but as you know, you will be muted and your camera will be off for today's presentation. If you have a question for our speaker, please go ahead and use the Q&A function on your Zoom dashboard. If something goes awry with logistics, use the chat. We'll see it no matter where you put it, so don't worry too much about that. If you have a question or if something goes awry, go ahead and drop those in either of those spots. Professor Stegall is going to take questions at the end of the talk today, but go ahead and put a question in as it comes to mind. If she ends up, covering it later on in the discussion, that's just fine. So go ahead and throw those questions in as they come to mind. Click on speaker view, helpful hint, to see the speaker in a larger frame. You can adjust it as we go, of course. And with that, it is my pleasure to introduce Professor Lisa Ferguson Stegall, Associate Professor of Biology here at Hamline, who directs the Exercise Science program and is also Director of Hamline's Integrative Physiology Lab. She earned her PhD in Exercise Physiology from the University of Texas at Austin and received further training as an NIH Post-Doctoral Fellow at the University of Minnesota Medical School in muscle physiology and aging biology. Dr. Stegall earned her MS in exercise science from George Washington University. And with that, I am going to hand it over to you, Professor Stegall.
All right. Thank you so much, Molly, for the great introduction. I am going to go ahead and share my screen with you right now. Get that going. Here we are. All right. So, as Molly mentioned, I last gave a similar talk 2 years ago, a little over 2 years ago in July of 2020. And of course, we know that we've learned a whole lot about everything COVID since then. That was a very different time. And so what I want to do today is share with you what we know now about exercise and immune function, some of which we already knew, but now we have confirmed. And then we've extended what we know quite a bit. So here's the roadmap for today. I'll start with the most important thing first, because I know many of you are very busy folks. You might not be able to stay for the whole hour of time. So I'm going to start with the take-home message very first, so that if you hear nothing else today, this is the most important part. But after the take-home message, I'll give just a little bit of a fun journey of who I am and how I got to Hamline. Molly gave you a little bit about my background, and I'll just kind of briefly extend on that for a second because it's relevant to the topic. And then I'll talk about what we have learned in the last 2 years about exercise and COVID and immune function. I'll start with a brief immune system overview. If you heard my talk 2 years ago, I went pretty in depth on the immune system, and I'm going to do a brief overview of it today, just in case you weren't here for that talk, or hey, it's been a couple years, so I'll give a brief overview of the immune system as relates to what we're talking about. And we'll talk about what we've learned as relates to COVID and exercise, also a little bit about the vaccine response. I'll also touch on influenza because we're coming into flu season, and we have learned more about flu and flu vaccine as well in the last couple of years. So I want to touch on that as well because it's important. I'll also talk a little bit about the challenge of awareness of the benefits of exercise as it relates to immune function. A student and I did a survey study on this topic in summer of 21, and we found some very interesting results, and I'm trying now to extend on that work in a study I'm planning to launch. So we'll talk about the awareness piece of all of this, and then we'll end with practical applications, news you can use. What kind of exercise do you need to be doing? How long do you need to be doing it each time? How frequent? How intense? I will give you those guidelines so you can start implementing this today. Well, today's a little bit rainy and cold, at least here in the Twin Cities, but you can start implementing this today. So let's start with the take-home message, which is exercise, moderate intensity, 30 to 60 minutes done most every day will boost your immune function. It just will. We know this. You will be less likely to get infected with COVID or the flu if you encounter it. Essentially, any upper respiratory tract infection that we could encounter, be it COVID, flu, the various forms of viruses that cause colds. If you are exercising regularly, most every day, as mentioned, moderately, 30 to 60 minutes, even vigorously, you are less likely to get infected to start with. If you do get infected, though, you're less likely to have a severe case. Your symptoms are likely to be milder, and you'll have a much lower risk of hospitalization than you would have otherwise. So the sweet spot in the exercise continuum really is this 150 to 300 minutes a week of physical activity, moderate intensity, or, and this is something that we've learned and confirmed in the last couple of years, 75-ish minutes a week, very vigorous physical activity. So we'll talk a little bit more at the end about what constitutes moderate, what constitutes vigorous, but think about brisk walking, not strolling and, looking at the leaves on a casual stroll, which is totally great. But if you want to increase your viral defense, you're going to want to walk briskly, heart rate up, breathing up a little bit, continuous. 75 minutes of vigorous, of course, vigorous would be more than that, higher heart rate, higher breathing rate, more like running. And we know, obviously there are people who don't exercise at all and they have lower defense against viral illness. And then those who exercise way too much, get overtrained and can also have a decreased viral defense. So there's really the sweet spot here. And now we have plenty of evidence to confirm this. So I want to give you my background. I'm going to see if I can't get rid of this little thing up top here. My background here, I started out in this field as an athlete. Many of us come into this field of exercise physiology as athletes who train and get really interested in the science behind it. And that was me. I was interested in how the body responds, particularly skeletal muscle, and how our muscle changes when we make more mitochondria, we get more efficient, we burn fat as fuel more, we're just healthier overall. And so in this process, I obtained my master's of science degree at the George Washington University, and I did research for the first time in elite cyclists. And I was really hooked on research. I got bit by the research bug while I was there. Also, while I was there, I got really interested in a subset field of exercise physiology called exercise immunology. Yes, that's a thing. So it's literally folks who study the effects of exercise or the lack thereof on the immune system and how the immune cells function and everything immune. So this was something I had run across. I'd run across this paper, Immune Response to Heavy Exertion. And this paper from 1997, so, it's kind of an older paper at the time, I ran across and it really piqued my interest. And this paper was written by David Neiman, whose picture you see here. And it turns out he's the father of the field of exercise immunology. So, and is today still the major player in the field, although the field has certainly grown. So fun story. I had gone to a conference, not this one, but one that looked similar. And if you've ever been to a conference, you're sitting there, you've got your reading material for between sessions. my reading material happened to be that paper. And I had highlighted it up. I had color coded it with all my Sharpies. I color coded all these things. I was like, oh, this is so fascinating. And it was tucked in a binder in my possession at this conference. And as I'm sitting there and speakers are changing out, I glance, to my left. I distinctly remember it's to my left. And there was a guy sitting there. And it was that guy, the father of exercise immunology. And I recognized him because he had a name tag on. And I reached over and I kind of tapped and I said, excuse me, I'm reading your paper. And I pull out this highlighted thing that had notes written all over the margins. And I said, look, I'm reading your paper. I really like it. And he probably thought I was crazy, but he smiled very graciously and said, oh, that's neat. Let's chat after this session. And graciously, he did chat with me after that session. And I asked 1,000 questions. And I was so excited to meet the father of exercise immunology. And even though I was never his student, he became one of my most important mentors. And to this day still is. We keep in touch. We're actually collaborating on a survey study currently. So I say all that because I really believe it's important to give shout outs to the people who have made a difference in your professional life. And so with great gratitude, I acknowledge the work of David Neiman. I also want to acknowledge the work of a good friend of mine who is retired now this past April, but was the deputy state epidemiologist at the Minnesota Department of Health, Richard Danella. He is my go-to for all things viral infectious and has answered more bizarre questions than I could ever imagine, but he has been my resource for all things COVID and preparedness. So I really am grateful for the people who have taught me what I know, because I am not an immunologist. Let me just say that I'm not. I'm an exercise physiologist specializing in aging and muscle physiology. But these folks have helped me become, knowledgeable in this area. So I went on to Texas, did my PhD there, working with trained athletes. I did some immune function stuff with those studies, and then on to the University of Minnesota as a postdoc, where I worked with aging mice and exercise, and also looked at some inflammation stuff and immune stuff, and continued my interest in that area. Now, as you know, I'm the director of the Exercise Physiology program, or Exercise Science program, at Hamline University, and I direct the Integrative Physiology Laboratory, my lab. And here's some of my phenomenal students in the lab over the years. We've done some really cool work. And of course, COVID kind of put a dent in being able to do lab-based stuff, but we look forward to getting back to that, hopefully in the near future. So that is kind of how I got to here. But if you were with me for this talk or similar talk back in June or July of 20, let's just go back there for a second. It was a really different pandemic place. I do want to caveat and say we are not out of the pandemic. We are still in it. But it is obviously a completely different place. Remember how Times Square was empty? Remember how we were all like freaking out about going anywhere? How do you get this? We were wiping down our groceries. There was so much we did not know. But, it's important to remember that even though we're in a different place and things are better, COVID has recently been ranked as one of the top 3 causes of death for the last 2 years. So it's been a long couple of years, and it's still long because we're still in this and people are still dying. And so COVID has really been pretty much second to heart disease for the last 2 years. And notice this data ends in January, sort of while the Omicron wave was still peaking. So, these data will change, but it's certainly going to continue, I think, for this year to be one of the top 3 as well. And I want to show you this because this is where we are kind of now. We have been floating in this period, from about the spring on, where we're having about 400 deaths per day from COVID in the US. In the beginning, that would have been unthinkable. But now it seems like people have just sort of shrugged and said, oh, well, but how does this compare to other causes of death? Cardiovascular disease, there's about 2,350 something deaths per day from heart disease. It's still the majority of our deaths, obviously. Cancer at about 1,670 a day. Stroke is about 405 a day. And so that compares pretty directly with COVID deaths per day. And for reference, drug overdoses are about 250 deaths per day. So we're talking a substantial amount of deaths per day that for, in large part could be mitigated to some degree. In 2020, we had an empty toolbox for the most part when it came to dealing with COVID. We had a couple things. We had masks, although there was a lot of, early on misinformation around wearing them and how to wear them, when to wear them. And we had social distancing. But outside of that, there really wasn't much, to say we had in our disposal to keep ourselves safe. And that's why there were lockdowns and all of that. Now, though, here's where we're getting so different. We have a lot of effective tools. We still can social distance and we still have mask wearing. Although I want to put this point out there. Cloth masks do almost nothing. Poorly fitted good masks do very little if they're not worn properly, if they're under the nose, if there's a big gap under the chin. And N95 is the mask that is going to protect you. A KN94, KN95 is also very good, but cloth masks are not going to protect you. N95s will. So we have those tools in our toolbox now. We have vaccines now. We didn't when I talked to you 2 years ago. We have vaccines, even for little kids. We have the antiviral drug Paxlovid. We have boosters. We have the updated booster. I just got mine 9 days ago. Super excited about that. My booster. One thing we did have in 2020 that nobody was talking about hardly was exercise. That was a tool in our toolbox and it was severely underutilized. Today, it is still a tool in our toolbox. Even better because now we know we don't have to worry about outdoors as much as we once did. So we can get even closer to our friends when we exercise outdoors, and that's a good thing. So we have tools in our toolbox now. Exercise has always been one of them. We just didn't do a good job as a society, public health society, whatever, of getting that word out. So I want to kind of flip back to here for a second, because this morning, I had to quickly update my slides because this morning in my morning briefing email from New York Times, they were talking about this issue of how we're still hovering around 400 deaths per day. And I screenshotted this for you to point out that I mentioned Paxlovid, the antiviral treatment. Dr. Ashish Jha, who is the very trusted, excellent scientist, White House COVID response coordinator, has said that a large chunk of deaths are preventable with Paxlovid, but people aren't asking for it, seeking it. Doctors aren't sure when to give it. It's been a real challenge of messaging, and we've done a pretty poor job of that. But he believes that daily deaths might fall to about 50 per day, down from 400 per day, if individuals over the age of 50 that do get COVID get either the Paxlovid treatment or monoclonal antibodies. That treatment I probably should have put in our toolbox slide because it certainly is one. It is still around. It is still a very good treatment, especially if someone has a medication interaction with Paxlovid and for some reason can't take it. Paxlovid is out there. Monoclonal antibodies are still out there. A lot of these deaths could be mitigated if these were put into practice in a timely fashion. So I also want to mention that this graph shows you the daily trends in COVID cases. Yes, it's trended down, but it's not falling to zero. And right before we started this webinar, I pulled up today's wastewater data from the Twin Cities, the Met Council wastewater data that looks at the total amount of viral RNA in the Metro plant wastewater. And what they said, I would have put this in a slide, but literally they just refreshed it at 11:30. What they said was the total viral load in the Twin Cities metro area has decreased by 43% since the end of June, but there's been no significant trend up or down for the past 3 weeks. We're just kind of hanging out in this little plateau. So COVID is still here, and it's expected to go back up again as colder weather moves on. So we really do need to think about, okay, what have we learned and what can we do to keep ourselves safe? Also, flu season's on the way. This is last week's surveillance report from the Department of Health, Minnesota Department of Health. 2021-22 season is the red line. And as you can see, it's beginning to kind of tick up, not at a huge spike, but it's beginning to go up. So flu season is coming. And guess what? Exercise is good for that too. Many of the COVID mitigation measures work for flu and other respiratory infectious things like colds. So obviously we know for the common cold, and by the way, that is common colds are going around right now really fast. So it's hard to know, is it a cold? Is it allergies? Is it COVID? Just got to take a test and go with that. But colds are really going around right now, probably because schools are back in session and all of that. We don't have a vaccine or an antiviral for the common cold, but you know what? Masks work, and so does exercise. It helps prevent infection. Flu, hey, we've got a yearly vaccine for that too. And we'll talk a little more about that later. We also have an antiviral treatment for the flu as well, the Tamiflu capsules that have been out for quite a few years. And guess what? Exercise is a preventative as well as a protective measure too. So these things work. We know that. And so we need to now think about how. So how does exercise do it? And what did we already know before today? Before the pandemic started, we knew that exercise definitely improved immune function by reducing the risk and severity of these infections. We knew that already. We knew that it improves surveillance against pathogens. We knew it lowered stress hormones like cortisol and the inflammatory response. We knew that those effects were transient, but really powerful for a few hours after. So you do exercise and then, wow, you have good immune function for a few hours after. Then it falls back to normal. But if you do it on a regular basis, it enhances the immune system all the time, even in people with chronic conditions like heart disease, diabetes, obesity, and even in the elderly who have lowered immune function just as a function of age. And like any medicine, there's an optimal dose. Too little, bad, too much can be bad. So, and we'll talk about what constitutes too much. All of these things have been confirmed to be true. And now we know even more about how they work. So what did we learn in these last 2.5 years? Before we get there, let's look at the immune system and just make sure we're all on the same page about the major players of the immune system and the parts that we're going to be talking about today. So the immune system is broken into two branches. There's the innate immune system, and that is what we're born with. And then there's the adaptive immune system. And that's the part of the system that we develop over time as we become exposed to more and more things. That's why it's called adaptive. So this is sort of the way it works with most bacterial or viral parasitic organisms. There is some threshold that we have to get exposed to in order to become infected to start with. Bear in mind, we encounter nasties all the time. If we, go out of our house, or even if not, we're still exposed to stuff. But most of the time, it doesn't reach that threshold that would cause any type of issue. Our body's able to deal with them. But once there's some threshold reached, and it's of course different for different pathogens, then you have the establishment of an infection. There's this inductive phase that happens where there's a lot of the innate immune system is rallying and clearing whatever the pathogen is, whether it's a virus or bacteria. The immune system ramps up really quick and works to clear that. Then there's crossover, of course, between these two. As the innate is getting, fired up and going and doing its job, the adaptive is beginning to go, okay, what is this? How do I establish, an effective response to help with this? How do I clear this out even better? And then how do I remember it so that I can recognize and deal with this the next time I encounter this? So the cells that are really important, and on this slide, the innate is over here on the right and adaptive is over here on the left. This slide shows you a lot of the major players of the immune system. The main ones of focus that we hear about the most in the adaptive immune system are the B cells that secrete the antibodies. They make and secrete the antibodies. And this is what we always hear about, the antibody response, the antibody response. We hear that our antibody response declines over time. We know that's well documented. But antibodies aren't the whole story, and B cells aren't the whole story. Yes, they have great potential, right? They make the antibodies that help to clear infection, and they make the memory cells that remember for next time. But T cells are really important too. We have gotten a lot of knowledge about T cells over these last couple of years. We know that they are incredibly important in mitigating the COVID response and helping us defend against that and heal from that. But they're much harder to measure than antibody levels. So a lot of what we've heard is antibody levels, but T cells are incredibly important too. There are a few kinds of T cells. All of them recognize protein antigens, so pieces of that pathogen, that virus, in this case, the SARS-CoV-2. They recognize pieces of that, and then they do their job, and they have a few of them, a few different jobs. So they're killer T cells. Killer T cells actually go and do, if you want to think of hand-to-hand combat with the virus-infected cells, to kill them so they can't further replicate. Helper T cells powerfully enhance the immune response and are a massively major player in the immune response because they interface directly with the B cells to help the B cells produce antibodies. And then regulatory T cells try to help prevent the immune system from getting a little out of whack and attacking its own self. And here we can see how the helper T cell interacts with another type of immune cell that has attacked a virus cell, taken a piece of that, chewed it up, spit it out, presented it to the helper T cell, who then talks to the B cell and says, hey, you need to make antibodies against this because it's pretty nasty. And then the B cell does so. The helper T cell also communicates to the cytotoxic T cell and says, which is also called a killer T, and says, hey, you need to go and destroy these infected cells because this is bad. So the helper T cells are extremely important in coordinating this defense. And by the way, we know how important T cells are because if we do not have them functioning, we die. And that is the basis of AIDS, right? And so helper T cells are extremely important in all kinds of viral diseases. And we know a lot about their function from HIV and AIDS research. So in a typical COVID-19 infection, in a young, healthy, robust person, you get this innate immune response, which, as you saw in the previous graphic, goes up, the innate part, and then it kind of goes down as the adaptive immunity takes over and does its job too. So we have antibodies being produced and they're doing their job. T cells, look at that, they go way up, they have a massive response. The red line is the viral load, and notice that it goes up, but the T cells and the antibodies are doing their job, so it starts to go down and the infection is over. So that's what would be considered typical. In severe COVID-19 infection, particularly in the elderly, particularly in those with underlying conditions, and especially in those with severe obesity, we see a very different pattern if you compare these two. So here you can see viral load goes up, but instead of getting abated, it continues to go up and is overwhelming. And this is in part because the innate immune response doesn't quite work as well, but when it does kick in, it works too well, it tries too hard, and then that leads to greater inflammation and damage. We also see that the antibody response is delayed and somewhat muted. But notice the big difference here in the way the T cells respond in these two conditions. The T cells are quite dysfunctional and really are not able to do their job. Aging can impact T cell function to a degree, but also inflammation and obesity can lead to damaged T cells as well as many other conditions too. So this is why we say, with underlying conditions, it is just really important to try our very, very best to mitigate getting COVID in the first place. So what we know now about exercise and COVID, we've always known that there's this awesome response where when people exercise at a moderate intensity, most days of the week for a long time, for years, this isn't something you just do for a week and then forget about it. They're at lower than average risk of an infection of any sort of upper respiratory type. We knew that, we've always known that. Now we're confirming it with COVID data. So this study was published in 2021 and looked at just shy of 50,000 adult patients who had COVID-19 in 2020. So this is pre-vaccination COVID time. So this group found that in these almost 50,000 patients, those who were completely inactive or consistently inactive, rather, had a far greater risk of being hospitalized and of dying of COVID than patients who were consistently getting the physical activity recommended guidelines, which were about 150 to 300 minutes per week of moderate exercise. So this data was pretty telling. It's like, okay, what we've known about upper respiratory, this holds true with COVID too. A more recent study, and when I say more recent, I mean like this was actually published made available online, and this is one of these that's free of charge, so you can go find the paper here. I've got the reference at the bottom. This came out in this form at the end of September. So this is really recent data. This group wanted to look at physical activity levels and the risk of infection, severity, and death from COVID-19 across bunches of studies that have been done over these last couple of years. So this is a systematic meta-analysis review of these studies. So this is pretty high quality stuff. You might have seen, this got a lot of attention a couple of weeks ago, or a few weeks ago, I guess now, in the New York Times with this article called "Can Exercise Strengthen Your Immunity?" And it was interesting because, for 2.5 years, I've been yelling, we need to get this word out, and we're finally getting the word out, but gosh, we still need to be doing a better job of it. But I'm glad the New York Times did highlight this. So with this meta-analysis, they looked at 16 studies. Mind you, there's way more studies out there on this topic, but they wanted to get the most high quality ones. So they had some pretty stringent criteria for what it took to be a study they included. So 16 studies qualified. The total number of individuals across these 16 studies added up was 1.85 million. That's pretty impressive. What they found was regular physical activity lowered the risk of getting infected with COVID at all. So lower risk of even catching it if you were exposed. But if you did catch it, the risk of severe illness or hospitalization was over 1/3 less with regular physical activity than those who did not perform regular physical activity. And COVID-related death was 43% less. So this is very, very telling and compelling. So it doesn't mean you'll never get infected with COVID if you exercise regularly, but, and you might notice the name here, father of exercise immunology, David Neiman, was quoted in this article, although he was not involved in that recent review They interviewed him as an expert, and he said in that article, even when people who work out do get sick, they tend to have less severe disease. And this is something we've known about respiratory tract infections pre-COVID, but now we know it's true with COVID as well. So you may get sick, but you hopefully will have less severe illness if you do. So the other interesting thing that the meta-analysis study added to what we know is that the greatest benefit of physical activity was provided by getting at least, ignore this for now, 500 MET equivalent. What that translates to in real people talk is 150 minutes of moderate intensity or 75 minutes of vigorous intensity physical activity per week. So there's the sweet spot. As I mentioned earlier in my take-home message, we now know what the sweet spot is for achieving these benefits. 150 minutes of moderate intensity or 75 minutes of vigorous intensity activity per week. But per week, every week, this is not something that you can do just on occasion and get the benefit. So back to the sweet spot slide I shared with you in my take-home message. We've always said 150 to 300 because that's the guidelines for physical activity, or 75 minutes a week. Meeting those guidelines that have been preached for quite a while is the sweet spot. The article said 150. Is it okay to go up to 300? Yeah, as long as it's moderate exercise. We'll talk about overtraining next here, because a lot of people want to know, well, geez, I probably get 300 minutes because I'm training for a marathon, but some of it's really intense, and am I doing myself more harm than good? So let's talk about what it means to be prolonged and intense. So this is called the open window hypothesis, that says the risk of catching some kind of respiratory infection are greater in the few hours, several hours, after you've done prolonged, exhaustive exercise. We're not talking about moderate to vigorous, an hour, hour and a half, 2 hours. That's one thing. I'm talking about going out for several hours, very intense, doing this every day, not recovering well. That is what we're talking about. Now, I'm being a little vague on the numbers because it really depends on the situation. Someone once asked me, I go walk for 3 hours a few times a week. Is that bad? Nope, because that's not exhaustive. But if you were doing, I'm going to say 3 hours of running at a high intensity most days of the week, then you might be experiencing this open window. And what is the open window? So here we have the period of time one is exercising, and then the recovery period when the exercise ends. Okay. And here on the y-axis, we've got immune cell counts. So in other words, how many immune cells are floating around in your body in the circulation looking for pathogens to defend you against. When you do moderate intensity exercise, so brisk, heart rate's up, breathing's up, but you can still talk, moderate intensity exercise, your immune cell counts go up during exercise because your heart's beating more, your blood is pumping, the circulation is moving. They kind of start to go back down to this baseline level, baseline normal. After exercise is over, they stay up for a little while, maybe a couple hours, maybe a few hours. They stay up and then they return to this baseline level. But if you go out there and you're doing super exhaustive exercise, so let me give you the example of, we just had the Twin Cities Marathon. So let's say it's an individual who ran the marathon, really put it all out there, completely exhausted, super, intense. Let's say they did a 3-hour marathon, super intense event. This is what I'm talking about. So after that bout, during the exercise, immune cells are floating around, they're fine. They start to fall off though earlier in the recovery period. So after exercise stops, pretty soon they go below the baseline level. What we're specifically talking about are cells like the T cells that we need to, kind of coordinate the response. We have some of the innate immune system cells called natural killer cells. Their activity goes way down, and they're kind of the first line of defense to run around and kill stuff. Their activity is super depressed. Other lymphocyte activity. So all of this activity and the counts of the immune cells too fall below the baseline. This is not what we want. And it stays below baseline for several hours after. So let's say after this marathon, the individual, goes into a restaurant, like, I am starving. It's really crowded. They're in there to eat their post-race meal. Somebody nearby has COVID. They're way more likely to get it in this open window period because the immune system is functioning below baseline. So that is the overdoing it piece of things. Most of us probably aren't doing that, but certainly I work with lots of elite athletes that do exercise like this on a regular basis, and I always caution them, be so careful in those hours after. And that would be my advice if that's you. Be really careful in those hours after. If you're going to go in somewhere, put a mask on, please. Make sure your booster's up to date. But those hours after are really crucial for exposure. So how does exercise work this beautiful magic? A lot of this we knew, but we have confirmed even more that surveillance against pathogens, it is just simply way improved. There's more of the early on innate cells circulating and looking for trouble so they can stop it in its tracks. The cytotoxic T cells, there's more of those surveilling our B cells and cells called monocytes. All of these things are circulating at a much higher level, and their activity is really important for keeping us safe. We know exercise lowers hormones like cortisol, and that's especially important because cortisol tamps down the immune system, and we don't want that, right? So exercise lowers cortisol, which kind of serves as a way to help protect the immune system in a secondary kind of way. Lowers inflammation, and we know that systemic inflammation is a major player with COVID severity, and exercise lowers that, and so lowers the risk of severity. We know, as I had said earlier, that this effect is acute. It lasts for a few hours, but when repeated regularly, our immune system simply functions better. And now we know that study that came out last month, people who get that recommended 150 minutes moderate to 75 or 75 minutes vigorous, less COVID infection, less severe illness, etc. And again, even in those with chronic conditions, including obesity, and even in the elderly with lowered immune function. And these are the folks that are still among that 400 deaths a day, right? And so these are the folks that we really need to get this information out to. Hopefully they're vaccinated. Hopefully they're boosted. Hopefully they're careful, if they know that they're going to be in an environment where they're likely to be exposed. But exercise works for these folks too, and it's so important to get that out there. I do want to touch on a study that came out recently that said that exercising right after a COVID or a flu shot can improve antibody levels. There's a whole lot more work to be done on this in this arena, but it's really interesting stuff to say that if you go out and exercise moderately, light to moderate, 90 minutes, in this case, it was 90 minutes of exercise. And this was either on a cycle ergometer, a stationary bike, or outdoor walking or jogging. The antibody response actually went up 4 weeks after the vaccine. This was true for COVID vaccine and flu vaccine. So there have been people who've said, gosh, should I exercise the day I get my vaccine? You sure can. It's not going to hurt. It might even help. We also know that vaccines, we have learned this and we're still learning this, that the efficacy starts to wane over time and that we have to address new variants as they come. So now we have the updated COVID booster. I want to just, remind you that waning efficacy is not unique to the COVID vaccine. We know it's true of flu as well. And there's been some new work that's come out, and you might have heard this on the radio. NPR has been covering this quite a bit. Mike Osterholm from the University of Minnesota Center for Infectious Disease Research and Policy has been talking about this. We now know that after being vaccinated for flu, there is a decreased efficacy in that vaccination. So let me back up and say that a little cleaner. After you get your flu vaccine, for every 28 or so days, you could say, let's just say a month after your vaccine, its efficacy is just slowly decreasing. And it's about 16-ish% per 28 days per month, say. So you get your flu vaccine, every month that goes by, the efficacy of it to keep you from getting flu is going down by about 16%. So that's interesting to know, because we know that, flu season sometimes starts earlier, sometimes starts later. If you were to get your flu shot, say in early September, but flu season doesn't really get going until December or January, wow, you're going to be on the tail end of the efficacy when flu season really gets ramped up. Problem is, it's super hard to predict what's going to happen. Another study followed up on this to say that not only are we talking about a decreased efficacy of just getting the flu, but for flu that leads to hospitalizations, so severe illness from flu among adults, the decline in efficacy of the vaccine from preventing hospitalizations is about 8 to 9% decline per month after your vaccine. And unfortunately, it turned out to be slightly worse in the elderly. It seemed to be more like a 10 to 11% decline per month from protecting against hospitalizations. So what does this really tell us? This tells us that flu vaccines offer relatively good, solid, strong protection for about 4 months, but it does steadily decline across that time and then beyond. So you need to planfully consider your timing of the flu shot, but it's really hard to do that because we don't have a crystal ball. So I would recommend keeping an eye on flu activity in the community. I showed you that chart earlier. It's from the Minnesota Department of Health Influenza Surveillance. You can sign up for that weekly email by going to their website. Keep an eye on flu activity. Some people are recommending waiting until mid to late October to get the shot so that you're good through, say, February. Other people are saying just get it now. Whatever you choose, just consider the timing. And remember that exercise boosts immune function too. So get your flu shot whenever it is you want to, and exercise. We also know that exercise is protective against a lot of different respiratory infections, bacterial, viral, even pneumonia. So let this inspire you to get out there and do it. Most people don't know this. This is how I know that most people don't know this. My student, Kylie Huseman, who has since graduated in the summer of 21, we did a survey to see if, do people know this? Do people know the effects of exercise on overall health? Do they know how it benefits the immune system? So we did an anonymous online survey of adults over age 50. We had over 300 participants. Average age was 64, 200 females, 100 males, 2 non-binary. And this is what we found. So we asked the questions. Well, first, let me show you the questions. We ask, do you agree, disagree with these statements? So exercise has a direct impact on health. Exercise has a direct impact on immune system function. Exercise can decrease individuals' risk of chronic diseases. We also ask, exercise can decrease an individual's risk of contracting respiratory infectious diseases like the flu or COVID. Exercise can decrease the risk of developing chronic diseases like heart disease or diabetes. And we ask them to say, do they disagree, somewhat, disagree, not sure, somewhat agree, or agree? And here's what we found. Everybody pretty much agreed that exercise has a direct impact on health. But when it came to the immune system, not as much. People were, most people said probably, yeah, I agree, somewhat, neutral. So there was less clarity on that. 94% agreed that exercise decreased chronic disease risk, but only 62% thought that exercise would decrease respiratory infectious disease risk. And there was way more sort of confusion over, can exercise decrease the risk of contracting a respiratory illness? We got to do a better job of getting this info out. We need people to know that exercise is a tool in the toolbox. We also need people to know that getting vaccinated and boosted are tools. We've done a terrible job of getting the booster info out. In the US, at least one shot is about 72% of the population of adults. 2 doses or 1 J&J, about 60 something. Even just 1 booster, some of us have had multiple boosters. Look how small of a percentage of those already vaccinated it is. It's like 25%. So please get your booster and let's get the word out that there are so many tools in the toolbox, and exercise is a huge one. So what kind of exercise? How long? How often? What can you use today with this info? So you've seen the sweet spot. What does that mean? And is there a preferred type? Yep. You know what it is? It's the kind you will do. Do you like to walk? Walk. Do you like to swim? Swim. What do you like? What won't you hate? Do that. That's the most important. But also it should increase your heart rate and your breathing. So how long depends on the intensity. So brisk walking of 30 to 45 minutes has been shown to be effective. You could achieve this, with cycling. You could go and do a spin class. I'm going to say that indoors, I'd kind of shy away from that, but you can do this away from other people. So if you're doing super intense, it can be shorter. You can go 15 to 20 minutes. There's less evidence on resistance only exercise. But if you're doing stuff like, chopping wood or moving rock piles on your property or something, if you're getting your heart rate up and you're doing this for blocks of time, that's going to be beneficial. So here are some definitions: moderate to vigorous, 30 to 60 minutes, and this should be about 60 to 70% of your age predicted max heart rate. I'm showing you 2 formulas there. The most common is the 220 minus your age. 60 to 70% of that, try to stay there. You should be able to talk, but not well, because you should be breathing hard too. High intensity interval training where you go really intense, but like 1 minute on, 1 minute off, 1 minute on, 1 minute off. About 20 minutes is the usual workout. We don't know what's the shortest time that could be beneficial, but certainly if you're doing HIIT training at about 20 minutes, that's going to do it too. And brisk physical activity. So like, gardening, construction, things like that. Variable timing, but if you're doing several minutes at a time and you're getting your heart rate up in blocks of time, that's going to be good too. So do it. Find something you like. Hopefully you're already doing this. Exercise most every single day, because knowledge is power, so is exercise. We have tools in our toolbox, and exercise is an incredibly powerful one. So use that info and keep yourself safe and share this info with others. I'm going to end with that, almost right on the hour. I hope we have time for some questions. If there's a question you want to ask me, and we run out of time, my email address is on the screen here, lstegall01@hamline.edu. Don't hesitate to email. I'll be happy to hear from you and answer your question if I can. Thank you so much.
If anybody has any questions, go ahead and drop them in. I have one. Is it fair to assume that that this data would hold for children too, for kids?
I would think it probably is. I mean, they're going to have a different, I don't know if anyone studied that. They're going to have a lowered workload though, right? Because they're not as capable of doing a 30 to 60 minute structured workout. In a lot of cases, depends on the kid and the activity level. But yeah, I mean, their immune systems are going to respond in like fashion. You just might want to dial back the duration so that it doesn't exhaust them, too early.
And what about, and I know you've alluded to this, you've referenced this, that it's getting your heart rate up for a specific amount of time to a certain degree. Strength training, is there a component where that comes into, is that complementary, or is that just a different conversation altogether?
If you can, so resistance training is great for a whole lot of things, right? But it's really about getting the heart rate up and from a, prolonged for at least a few minutes at a time. You could do resistance training in blocks, kind of like interval training, where you do, lifts and then take a break, do lifts, take a break, making sure the heart rate comes up and down in those times. Lifting in a fashion where the heart rate doesn't come up, I don't think is going to be as beneficial for sure, because it's really about stimulating blood flow and getting the cells in circulation, surveilling through the whole body. And so you got to get your heart rate up for that to happen. I mean, certainly there are other benefits of resistance training that could lower inflammation and those other things too, but sort of that pathogen surveillance is going to be achieved less so if you don't get your heart rate up.
Here's a question. Any research out there in regards to exercise with long COVID, especially when fatigue and exhaustion are big symptoms?
Yeah, that's a great question. I think that there is going to be a lot more coming on that topic. I know that people are working on it. It's such an important area. We're just now really begin to understand how many people do have long COVID and start to study them and follow them forward. There may be stuff out there already that I am unaware of, but certainly it's an active area going forward, because fatigue and exhaustion are highlights of long COVID. And so, yeah, there's going to be a lot more coming on that. I don't have anything definitive right now. Not to say someone isn't doing it though.
One last question. When I walk my dog 1.5 miles every day, he stops frequently to sniff. Does this negate the benefit? Should I push him harder?
Yes, no. Yes, you're not getting you're not getting the quality of the exercise that you need, but your dog is getting what he needs, right? So I'm going to say the best idea would be either to combine and say, okay, my dog gets his sniffy sniff time, because that's what dogs do, right? That's why they want to go on a walk, is so they can sniff all the messages their friends have left and leave messages too. Don't deny your dog that opportunity. Let them either set aside like, okay, we'll do that for 15 minutes and then we're going to walk for 30 minutes. And then I'll give them sniff time again at the end, right? Make it work for both of you. Or you could walk your dog and then go for your walk, like use your dog walk as your warm up.
All right. I think we've got all of our questions and it's 12:31. We're doing really well. Thank you so much, Professor Stegall. Thank you. And everyone who joined us today, we will put this talk up on our alumni website sometime next week. It'll likely be up there, so you can come back and reference this. And as I put in the chat earlier in the session, the 2021 is there too. And we had a question about providing resources in some of the research, and Professor Stegall and I will connect on that, and I have everybody's email addresses, and we can reach out after the fact.
And in my slides, the citations for all the different studies are down along the bottom. And so if there's anything in particular, like a certain paper or something that you want, just let us know and I can make sure we get to that.
Yeah. Next Leo lecture, November 11th, Professor David Schultz. It's right after the midterm elections. It will be about the midterm elections. I will tell you, almost every time we've had Professor Schultz talk during election season, something, we don't really narrow down a topic because things really happen right before. So we just kind of go with it. But you can find information about that on our alumni relations webpage. And with that, thank you so much, Dr. Stegall. Thank you. Have a great weekend. Everybody exercise. And we will see you next time.
Thank you so much.
Bye-bye.
Bye.